Take 12. Blank sheet of paper other than what she's going to read. Okay. Knock, knock, knock. Good morning, my name's Carrie. I'm a student from Southwest Tech. I'm here with an order to do a full body assessment of you. I'm going to wash my hands quick. I'm going to pull a curtain for some privacy. Kelly, can you tell me your name and date of birth?
Kelly, December 5th, 2003.
And I'm confirming that on your bracelet. Kelly, do you have any allergies to anything?
No.
No. Okay, so like I mentioned, we're here for a full body assessment per your doctor's order. So to get started, we're going to work from head to toe and do this as quickly as humanly possible this time. So we're going to start. I need my pen light. Get rid of this for just a second. Okay. So Kelly, I'm going to start up here at the top, assessing with your eyes. Do you have any problems with your eyes?
No.
Any difficulty reading?
No.
Do you wear glasses or contacts?
Yes.
Okay. Any drainage or anything?
No.
No. Okay. I'm just going to take a peek. Your entire face is symmetrical. Your eyes are nicely centered. Nose, lips, everybody is symmetrical. Your eyebrows, eyelashes, everything looks good. The conjunctiva, my hands are clean, but conjunctiva looks good. The sclera, the whites of your eyes are nice and white, so that is good. I'm going to go ahead and take a peek at your pupils. I'm going to cover up this side, look right at me, shine a light in your eyes. Accommodation is good there. I'm going to do the same thing on the other side. And accommodation is also good there. Now I'm going to have you look way out into the future. And that looked really great. And keep looking way out into the future. And pupils are accommodating very well. So that's good. Now I'm going to wiggle my fingers and you tell me which side I'm wiggling on, left or right.
Left.
And now?
Right.
And now?
Right.
And now?
Left.
Okay. Any problems with that at all?
No.
No? Okay. And then I'm going to have you follow my finger. And... oh, this is fun. Everything looks good there. Her eyes are following my finger real well. Then I am going to assess your reading to make sure that you can read well up close. Kelly, can you read to me what this says?
This is getting old. I am bored, but I love my mom.
Oh, yeah. Nice. So her reading skills are good. So that is good. Now we're going to move on to your ears. Any problems with your ears recently, Kel?
No.
Any drainage?
No.
Pain?
No.
History of ear infections?
No.
Nope. Great. So we'll pretend like this is my otoscope, so we'll be using that again shortly. Tell me which side I'm clicking my finger on.
Left.
How about now?
Right.
Okay, so your hearing seems to be good, and you're hearing me okay?
Yep.
Any difficulty hearing people with high voices, low voices, anything like that?
No.
No? Okay. So I'm just going to feel your ear. Any pain around the ear or with the ear with the movement?
No.
No. And I'm pulling up, and any pain, pulling down, any place?
Nope.
Nope. Okay. Then I'm going to look into your ear here with my otoscope. I would be specifically examining her ear canal, looking for any redness, excess serum in her ear wax. I'm looking at her tympanic membrane, which should be a nice pearly white. I would do the same thing on the other side. We always want to do everything bilaterally and make sure that everything is bilaterally equal. So everything looks good in accordance to her ears. Next, we're going to be checking out her nose and mouth. Like I already mentioned, her face is nice and symmetrical. Her nose is centered. I don't notice any nasal drainage. Kelly, do you have a history of sinus infections?
No.
Any problems breathing at night? Do you snore?
Nope.
Nothing? Okay. So I don't see anything draining. I'm going to go ahead and peek up in your nose, and up inside of there, everything looks normal, and I can pick it up and it all looks normal in her nose. Kelly, I'll have you sniff, and I'm going to have you sniff again. Okay, so she sniffs. Patency seems to be good. Her nasal cavity looks good. Next, I'm moving down. Oh, we're going to do her sinuses. As I palpate your maxillary and your frontal sinuses, do you have any pain with either of those?
No.
No? Okay. Both sides equally, feels the same, no pressure or anything? Okay, great. Then we're going to go down to your lips. Lips look normal. They're not dried. They're not cracked. Any problems with your lips, mouth, teeth, gums, throat, anything? No. I'll have you open your mouth real wide, stick your tongue out and say ah.
Ah.
Okay. And tonsils and throat look good. And I'll have you pull your bottom lip down and your top lip up. And let me see your teeth. Great, so her oral hygiene looks good, her gums look good, her tongue looks nice, I don't see any bleeding in there. It appears that she brushes her teeth. Can I have you swallow for me? And any difficulty swallowing?
No.
No. Any pain when I palpate your neck here?
Nope.
No? Okay. So that's all good in regards to the mouth. So now we're gonna have you stick your tongue out, up, down, and so that's just going to tell me for our cranial nerves later on that her tongue is moving well. Then I'm going to palpate her lymph nodes. So we're going to start back here at the back of her head. Hilly, do you have any pain when I'm palpating around, when I'm feeling around on you?
No.
Nope. So I'm feeling her occipital, her post-auricular, her pre-auricular, submandible, her submental, her post-cervical, her pre-cervical, her supraclavicular. Any pain with any of these?
Nope.
Nope. So with all of those guys, I'm feeling for any swelling, noticing if she mentions any tenderness, but I didn't notice anything there. So nextly, we're going to go ahead and do the skin assessment of her. So I'll have you pull your sleeves up, your pant legs up, and you can take your socks off. I'm noticing that her balance is okay here. She's able to do that herself, so I don't have any concerns there. I'm going to get rid of my pen light. In checking out her skin, I'm looking for any abnormal lesions. Normally we would be in a gown and we would do a full skin assessment. Kelly's only 13, can't have her in a gown. She's not going to be taking her shirt off for any of her assessments. So in looking at her, I'm feeling her temperature. I'm noticing her skin. I'm looking for abnormal lesions, moles, anything. Kelly, do you have any skin concerns?
Nope.
Nope. Her skin temperature feels normal. I'm also looking for signs of phlebitis. Any signs, any veins that are red, hard, swollen, rope-like, and I'm not seeing any of that. I come all the way down. I'm also looking at her fingernails and checking the perfusion of her skin and at her nails, and her perfusion is good. Skin color, everything looks normal. Any pain in your joints at all?
Nope.
Nope. Temperature feels the same. Coming all the way down, I'm looking at her legs and her feet, and everything looks good. I don't notice any phlebitis in her legs. I don't notice any abnormal swelling. Her edema, she has no pitting edema, so I would label her as 0. I can press on her skin here. So everything looks great there. I'm also going to check her capillary refill, and everything looks normal and equal on both sides. For capillary refill, top to bottom skin, everything looks good. I felt all of the majority of her joints. I'm not noticing any problems with that. So now we're going to check some muscle strengths on her. Hill, can I have you shrug for me? Great. And I'll have you look towards my hand. And look this direction. Okay, and there I was checking her sternocleidoid mastoid in her neck, and with her shrugging, we're feeling her trapezius. I'll have you put your arms all the way out, press up on my arms. Okay, go ahead and push down on my arms. Great, I'll have you put your arms like this. Don't let me pull you, and don't let me push you. So deltoids, triceps, biceps, everything in her arm is good. So I'll have you grab my fingers and pull. Okay, and then let's push your hands against mine. Okay, so I'm noticing that her joints are all moving freely. I'm noticing that her grip strength was good, and her arm muscles were all good. So everybody there is good. So moving on down, I'm going to put my hands here on your knees and have you push outward. Okay, so her adduction is good, and then push in, adding in, adduction was good. Her adduction moving outward of the hips, that was good. Any pain in your hips in doing that?
Nope.
Nope. Okay. And then I'm going to have you push up on my hands with your kicking your legs out forward. Nope. Okay, that feels good. Come on back down. So her quads and her hamstrings are feeling strong. Have you push up on my hands. Okay. And then go ahead and push down. Great. So her feet and ankle strength is good. Her range of motion equal bilaterally strength is good. I don't have any concerns in that regard. I'm going to have you stand up now, and we're going to assess your spine. He's another important one. I'll have you turn sideways here. Go ahead and bend over just a little bit at the waist. Perfect. Get your hair out of the way. I'm feeling your spine. Any pain here in your spine?
No.
No, and I can feel all the way down that her spine is nice and straight. You can go ahead and stand up and just stay standing here. Her spine is nice and straight. There's no scoliosis, which is the S, lordosis, or kyphosis, which is abnormal curvatures either other direction. She's not humped back, so I'm not concerned with her spine at all. So while you're standing here, Kel, I'll have you go ahead and face the camera again. Put your arms out at your sides, shut your eyes, and just stand real still. Great. Go ahead and touch your nose with your finger. And again on the other side. Great, and you can have a seat again there. So there I was checking her Romberg reflex, which was her balancing reflex. So everything looked good there. Kelly, do you have any loss of consciousness in the past?
No.
Nope. And we would also want to assess, make sure that she's alert, knows her name, where she's at, the date, all of that. Do you remember who your first grade teacher was?
Mrs. Strobush.
Mrs. Strobush. And where did you go to school at?
Lancaster.
Good. So her memory is good also. Next I'm going to go ahead and check her Babinski reflex, which is the bottom of your feet. So I'm going to pull her foot up like this, and then I'm going to go up her foot and towards her big toe, and she's not curling up excessively. So that's good. And then I'm going to do it again. Come up the outside, or the outside, coming up medially to her great toe. That was also good. Equal on both sides. No abnormal reflexes there. So then I would wash my hands again. Wash my hands again. And then, Kel, we're going to check your gait and see how you walk. So your gait is how stable you are when you walk. So if you want to stand up, head over towards the love seat over there. And then go ahead and walk across the room for me. Great. And come on back. Perfect. You can have a seat back in your chair. So as I watched her walk, she was very stable, steady. She wasn't wobbling. She wasn't limping. She wasn't leaning towards one direction. Her gait was also good. Let's see. Did we mention your fingernails? Your fingernails, there's no spooning. There's no clubbing. There's no excessive swelling at the end of her fingers. The temperature of her fingers is also good, as it was equally and across all of the rest of her body. So next we're going to go ahead and do her cardiac and listen to her heart and listen to her breathing. So as we've been doing this, I'm noticing that her hearing is good. We checked that. Her sight is good. Her breathing appears to be regular and normal. Kelly, do you have any concerns, any history of asthma?
No.
No. Any congestive heart disease? Anyone in your family have a heart attack?
No.
No? Are you a tobacco user?
No.
No? Okay, and have you ever had an inhaler or needed a nebulizer, any history of pneumonia, anything like that?
No.
No? Okay, so that tells me that her cardiac and respiratory history should be pretty normal. So I'm going to go ahead and just feel here as you breathe for me. And I'm not feeling any rattling. Do you have any pain or anything in your chest?
No.
Nope. So that I'm feeling for rattles and everything. I'm feeling the pericardium around her heart. Everything feels normal there. So next we're going to go ahead and listen to her heart. So a couple of things to mention is the Erb's point is where you can hear her heartbeat the best. But another thing is the lub-dub. The lub is going to be at the tricuspid and the mitral valve, which is the lower valves that we're going to be assessing here shortly. And then the S2 is the dub. So we have the lub down here, the dub, S2, S1, S2, aortic artery over here, and the pulmonic artery over here. So we'll go ahead and assess those guys. Second intercostal space on the right is where we're going to best hear her aortic artery. And that sounds good. And then we're going to do second intercostal space on the left is where we're going to best be able to hear her pulmonic artery. And that sounds great. And just below that is going to be the Erb's point, which also sounds good. And then we go all the way down to the fourth and fifth intercostal spaces, which is where we're going to hear the down. Now, on females, if the breasts are in the way, we would have to lift the breasts and move that. But here, should hear it best about here. It's the tricuspid valve. Then the point of maximum impulse, or the mitral valve, is over here, which also sounds good, and normal heartbeat sounds regular. Didn't notice any swooshing, I didn't hear any murmurs, I didn't hear anything out of the ordinary. If she had her shirt off, we would assess to make sure that we don't see any abnormal pulsation going on in her chest. It would be normal to see some pulsation over here, but no place else. To her shirt, I'm not noticing anything, but you wouldn't be able to assess it with her shirt on. So next we're going to do her respiratory assessment while we're up here. Kelly, you said no history of asthma or anything like that. Okay, so we're just going to go ahead and listen to her lungs on both sides. So for this, we would listen with the bell and the diaphragm, always with the bell and diaphragm. Bell for low, diaphragm for high pitch sounds. I don't have a bell, so I can't listen to both, but we would have listened to her heart. One thing that I also should mention is if I had a bell, we would listen to her carotids, but I'm just going to go ahead and demonstrate that with the diaphragm here. So Kelly, I'll have you take a deep breath in and hold your breath. And I'm listening to her carotids, and everything sounds good there. And also, while we're talking about the heart, we're going to go ahead and feel for her arteries here. So we have the temporals up here, which I feel are normal and strong. And then the carotids are here in your neck. You wouldn't feel both of them at the same time because you wouldn't want to occlude them both. We don't want to make her pass out. And they're strong, normal, equal on both sides. And then here we have the brachial. And then we're moving down, we have the radial pulses here. And they're both equal and strong on both sides. The femoral are here in her groin area. Then we have the popliteal, which are behind her knees, back here. And then the posterior tibial are back here. And then the dorsalis pedis here on the top of her feet. And everything is equal and normal all the way down with those. If we were having problems with finding those, or we were concerned with her blood flow, we could get a Doppler and we would assess them using a Doppler. But we don't have any concerns with Kelly. Everything's equal, normal on both sides. So that was good. So back to where we were at here, we're going to go ahead and listen to her lungs on both sides. So like I mentioned before, her lungs have, her breathing pattern has been normal. So let's start here. Just breathing normal. Then we want to swing all the way out to the outside edge so we can get the lungs on the outer edges. Then Kelly, I'm going to have you turn around so we can assess your breathing, the lungs posteriorly. So I'm going to have you take some deep breaths through your mouth for me, please. And I'm not feeling any rattling. I'm not hearing any wheezing, crackles, anything like that. Lung sounds are still good. So I'm going to have you say 99 as I feel all the way down your back.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, and then while I'm down here, I'm going to have you take a big deep breath through your mouth and then exhale again. Great. So what I was checking for there is to make sure that her lungs are both expanding equally, which they did. Both sides came out equally. I also noticed that the symmetry of her A&P chest, that she's symmetrical this direction versus this direction. She's normally symmetric there also. So that's all good. So now while we're still doing this, I'm going to go ahead and listen to approximately 18 spots down her back while she's breathing some deep breaths through your mouth, please, Cal. So here I'm listening for crackles and rattles, rhonchi, wheezes. Then you'll notice that I move all the way to the outside. Make sure to get the outside edges. I'm coming back all the way across. Okay, breath sounds are equal on both sides. Didn't notice anything out of the normal. So we felt everything. I'm not feeling any rattles. We've assessed everything there. So I think from here, we're going to go ahead and assess your jugular vein distension and do your abdominal assessment. Before we do that, Kelly, do you need to use the restroom to empty your bladder?
No.
No. Okay, then go ahead and move over to the couch. I'm going to have you in the supine position, which is on her back. If this was an elderly person, I would obviously help her over to the couch. She does not need to use the restroom. So lying flat on your back, Kelly, you can just hang tight. I'll have you lift your head up so I can check your jugular veins. And I don't see her veins at all, so that's good. If I did see her veins, we'd raise her up to approximately 45 degrees and reassess her veins. Don't need to do that. So light's good. We've already assessed, listened to her heart. So I think we'll go ahead and assess her abdomen from here. So here we're going to just lift her shirt up for this. Kelly, have any issues with your abdomen, your digestion, any constipation, diarrhea, abnormal lesions, anything?
No.
No? Okay. Then I'm going to go ahead and listen to you. Hey, buddy. Here first. Right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. At this time I could flip it over and I would use my bell to assess her arteries that are in her abdomen region also, which would be her aortic, her renal, upper, and then the iliac on both sides, left and right, which are lower. And then also we would listen to her femoral arteries. I don't have a bell, but I could do that, and we would be listening for essentially to hopefully hear nothing. Then we're also going to percuss her belly. Any pain here, Kel?
No.
No. Everything sounds normal here as we're doing this. If Kelly was ticklish, we could use her hand and we could tap on her hand. Is how we would do that. Then I'm going to palpate here. I'm not pushing real deep. I'm just going a couple of centimeters, feeling any pain here.
No.
Okay. Then I'm going to have you pull your chin quite a ways forward. Okay, and as she does that, I would be looking, assessing for a hernia, and I'm not seeing any hernia, nothing bulging out of her abdomen. So her abdomen is looking good. So Kelly can help you sit up here, turn around here. So at this time, let's see, we did the muscles, we did the lymph nodes, we did all the assessments top to bottom, I believe. So now we go back and we're gonna go ahead and discuss our 13 cranial nerves, which we go back to what Kelly read on my order, and it is all to touch and feel. Very good. Have it. Olfactory is the first one. That is for smelling. The second one is optic. That is for sight. The third one is ocular moto. That is for the eyeball movement. Number 4, trochlear. That is also for the eye. Next comes, the next T is trigeminal. That is for chewing and for facial muscles. After chewing and the trigeminal comes the abductions or abductions, which also moves for eyeball movement. The next F is going to be your facial for facial movement and also to help you with taste. The next V is vestibular, cochlear, which is your auditory and for hearing. Next comes the glossopharyngeal, which was for the tongue movement, which we already assessed earlier. And then comes your vagus. Vagus is for respiratory, for swallowing, for your gag reflex, which we did all of that, and she had no problem with. The next A is accessory. Accessory, I remember, is an accessory to help you speak. And the last one is the hypoglossal, which also is for swallowing and speech, and things such as that. So that is our 13 cranial nerves, which we have pretty well covered all the way down. Did we nail everything this time?
I think so.
I think we did too. So, Kelly, I believe that concludes our full body assessment. I hope for real this time. So, While I'm here, Kelly, is there anything else for you that I can do?
No.
No, at this time, I would go ahead and document and hopefully upload this video to YouTube. Thank you for your time, Kelly.